Dear students, welcome back. In this session, we are going to discuss about the mechanism of iontophoresis. Okay, so normally if a voltage is applied to an electrolyte, normally we know that voltage is applied to an electrolyte. Okay, one is we are having positive pole and negative pole in the electrolysis, isn't it? So then what happened? Movement of positive charged ions towards the negative pole. For example, this one is negative and this one is positive. So movement of positive charged ions towards the negative pole and movement of negative ions towards the positive pole. Isn't it? The same thing is also going to happen in the mechanism of ion transfer in the iontophoresis. Okay. Yes. When a drug is in the ionic form, that is, it has a charge, isn't it? Yes. It can be made to move in either direction depending upon the polarity applied. When a solution of the wet pad or sponge that contains the drug is applied over the skin and a constant direct current is passed. So here this one is the positive electrode and this is negative electrode, and this one is connected to the a source of battery or anything which produces constant direct current. So what happens? Electrolysis of the chemical produces ions. So what is happening? Normally here in between the electrodes and the skin, in between this one is electrode and the skin, we are keeping a pad or a sponge which consisting of a drug solution, isn't it? So whenever these two pads are connected with the electrodes and a constant direct current is passed, what is happening now? Electrolysis are going to takes place inside this pad. Okay, yes. So then what happens? That means positive ions and negative ions are formed inside the pad. Then what will happen? So already this positive electrode will have positive ions and this negative electrode will have negative ions. So what is the working principle in the iontophoresis? So like charges are going to repel, isn't it? Here in this, positive ions are repelled into the tissue by the positive charges. So here in the pads we are getting negative ion, positive, negative, positive, negative and positive ion. So what is happening? Already this positive electrode will have positive charge, that is anode, isn't it? So what is happening? So with this positive charges, these positive ions are going to repelled. So once repelling happens, these positive ions enter into the tissue. Okay. And the same side, on the other side, that is negative electrode, which is having negative charges, and these negative charges are repelling the negative ions into the tissue. This is the thing happening here. Okay. Yes, the positively charged ions produced are made to drift away from the positive charged pole towards the negative pole. So this one is going to, positive ions are going to negative pole and negative ions are coming to the positive pole. Okay. Yes. So the drug that is introduced through the superficial layers of the skin are driven further deeper by the formation of compounds in the bloodstream. So if normally the depth is not that much satisfactory in the iontophoresis. Once the drug, when it is mixed with this bloodstream, then there may be a chance of entering into the deeper tissues. Okay. So an additional mechanism of the drug delivery involves the passage of solvent which can carry dissolved substances through the skin due to direct current. So this form of is called as electro osmosis, and it is also called as iontophoresis, and which is strongly dependent upon the pH of the skin. So this is mainly depend upon the pH of the skin. Here the actual passage of current, hence the ions occur mainly via the sweat gland ducts or to lesser extent via the hair follicles and sebaceous glands. So the effect of any drug introduced by iontophoresis are likely to be either local in the skin under the active electrode or systemic, because when the drug enters the tissue fluid, it is disseminated throughout the body tissues. So this is the mechanism of ion movement in the iontophoresis. Now we will see some of the physics which is related to the iontophoresis. Okay, yes. So the current which is required for the ion transfer is the continuous galvanic current, which is obtained from the standard low voltage generators as well as batteries. Okay, battery operated units that are now available to the clinicians also. Okay, so the treatment is not the direct current itself but the ions introduced. So it also not only depends upon the continuous galvanic current, and it also depends upon the ions which we are going to introduce into the skin. These are the two factors mainly involved in this physics. Okay, here if you see, the selection of the specific substance depends on the target reaction or condition. So here the substance what we are going to use mainly depends upon the condition or the reaction what we want to get. Okay, so the technique is completely non-invasive. And the ion concentration required is very low. Okay, so we require some of the physical considerations to be done while following the iontophoresis. One is the amount of substance introduced. So the basic formula for using iontophoresis, to know the amount of substance introduced in grams is, okay, here we can see the formula I into T into ECE. So where you people know I is the intensity of the current in amperes, T is the time in hours, and EC is the electrochemical equivalence of the substance. Okay, so here the number of ions entering the tissues from any given area of active electrolyte is proportional to both the current density as well as the time of application. Okay, in fact, the number of ions introduced has been shown to be proportional to the cube root of the product of current density and time of application. So for practical purposes, the current density is limited by the skin tolerance, which usually allows between 0.1 and 0.3 milliamperes per centimeter square. Okay, this is the amount of current density we are going to use. Okay, next one is the ionic polarity. The basis of successful ion transfer lies in the physical principle. One is like poles repel and unlike poles attract. That is the main principle. The ions being charged particles with positive or negative valencies are repelled into the skin by identical charge on the electrode surface placed over it. Once subdermal, the ions introduced recombine with existed ions. So what do you mean by existed ions? Normally inside the tissue or inside the bloodstream we are having different ions. So with existing ions and radicals floating in the bloodstream, forming the necessary new compounds for favorable therapeutic interactions. That is about ionic polarity. Now if you see the low level amperage, so the lower the intensity of the current, greater the amount of penetration of the ions through the skin. So lower the intensity, okay, and which causes greater the amount of penetration, greater the amount of penetration of ions. That means so intensity is inversely proportional to the amount of penetration. Okay, penetration of ions through the skin. So lower the intensity, higher the penetration. Okay. So the physics involved with iontophoresis necessitates low milliamperage and low percentage of ion sources. And now coming to the enlarged negative electrodes. So this is very, very important. The negative electrode is more irritating than that of positive due to the formation of caustic sodium hydroxide under the negative electrode. High concentration of hydrogen ions and the relative rapidity of reactions of the cathode suggest a method of reducing the current density under the negative electrode. So to avoid undue irritation and possible burns. So this is best done by making negative electrode larger than the positive electrode. So you can make the negative electrode larger than the positive. Okay. So, and should be done if the negative electrode is the active or the driving electrode. So, for example, if the negative electrode is active in the iontophoresis, then also you have to take this negative electrode as larger than the positive electrode. Okay, most users use a cathode 2 to 3 times larger than the area of anode. So this is about the physical consideration which was required for the iontophoresis. Okay, now we'll move on to the physiological effects and therapeutic effects of the iontophoresis. Okay. So, what are the physiological effects of the iontophoresis? Okay, the physiological effects of ion transfer can only be expressed in terms of ion selected for the treatment. So, since each ion is different, specific ions are utilized for the treatment of pain, spasm, and inflammation, and some of the effects common to all are. So one is the ion penetration, next one is the acid alkaline reaction, hyperemia, and disassociation. So if you see the ion penetration is generally less than 1 millimeter with subsequent absorption to deeper tissues via capillary circulation and transmembrane transport. So the ion penetration is generally less than 1 millimeter. Okay, so the depth of drug delivery with iontophoresis, though uncertain, certain studies have demonstrated the penetration to a depth of 3 millimeters to 20 millimeters. Okay, the bulk of the ions deposited are found directly at the site of the active electrode, where they are stored either as a soluble or insoluble compound to be depleted by the sweep of the circulating blood and or utilized locally as a concentrated source for further recombinations. Okay, this is about the ion penetration. If you see the acid alkaline reactions, so normally so the reactions which are taking place at the anode and the cathode. Okay, what are the things? So the anode produces an acid reaction, so a weak HCl, whereas a cathode produces a strong alkaline reaction as sodium hydroxide, NaOH. So the anode is sclerotic and tense hardened tissue serving as an analgesic. So anode is a sclerotic and tense hardened tissue serving as an analgesic, possible due to the local release of oxygen aiding in the vitality of the tissues. The cathode is sclerolytic. So this one is sclerotic and cathode is sclerolytic, and it is a softening agent releasing hydrogen, and it is used clinically in the management of scars, burns and keloids. Okay, and next one is the hyperemia. The anode and cathode both produce hyperemia due to vasodilatation as a result of heat production in accordance with the Joule's law. In most instances, the reddening of the skin under both electrodes disappear within 1 hour of the treatment. The cathodal hyperemia is generally more pronounced and lasts a little longer than that of the anodal one. So this is about the hyperemia. And if you see the dissociation, normally ionizable substances dissociate in solution, releasing ions and radicals free to drift towards the opposite poles. When a direct current is passed through the solution, following the rule that unlike poles attract. Okay, and the ions so dissociated combined with the ions in the tissue fluid, thereby forming compounds in the tissues which bring about the therapeutic effects. Okay, so the additional current enhanced flow of electrons increases this normal migration and gives meaning to the concept of ion transfer or iontophoresis, because various tissues offer different resistance to current flow. Electrode placement becomes a vital factor for this iontophoresis. These are all the physiological effects for all the ions. These 4 are common to all the ions, and we are using specific ions for specific treatments, although all the ions will show such kind of physiological effects. Okay, and if you see the therapeutic effects of iontophoresis, which depends upon the nature of the drug introduced into the tissues, a very large number of substances have been used for a vast range of therapeutic purposes over the years, most of them with little success. So here we can see there are different kinds of ions. We can see here, yes, various types, and which are having some therapeutic uses and their characteristic features. Here so many ions are there, both positive and negative ions are there. So I want to mention some of the effects of this some negative ions. I'm going to take this iodine. So here this is the iodine. So these are obtained from a solution of potassium iodide and have an irritating effect on the superficial sensory nerve ending, and consequently the iodine ions increases the vasodilatation and relief of pain by counter irritation, which are normally obtained at the cathode. Okay, and these are used in the treatment for chronic inflammatory lesions. Iodine ionization is also sometimes used for softening the superficial what you can call as scars. Okay, but the effect is probably due to increased blood supply and fluid content of the tissues rather than to any specific effect of the iodine ions. Okay, and if you see the chloride ions, these are obtained from the solution of sodium chloride. So here again the negative ion. So this one is used for softening of the scar tissue. This is the thing. Okay, and we can take salicylate ions. These are obtained from the solution of sodium salicylate, and these are sometimes used in the treatment of inflammation, that is rheumatic conditions. Okay, yes. So now we will see some of the positive charge, that is zinc ions. So this one is positive. So it is obtained from the solution of zinc sulfate or zinc chloride. Here they have mentioned zinc oxide also, for the treatment of infected superficial wounds. So simply they have mentioned as dermal ulcers, superficial wounds, sinuses and mucous membranes, also for destroying exuberant granulations on wounds. Okay, so these are all the various types of ions which shows some therapeutic effects. So this is all about the ionization. In the next session we are going to discuss about with a new topic. Thank you.